Discharge after a critical illness. It's the day you and your family have looked forward to and fought for. A day of celebration, and also a critical transition for you. You'll no longer have people to answer questions or take care of you 24 hours a day. So, while you're excited to leave, it's also normal to feel anxious. These feelings are so common, they have a name: relocation stress. It's recommended that you have a friend or family member with you. You need to review the discharge plan carefully and ask questions until all of them are answered. Here are 5 things you need to consider at discharge. First, do I have all the equipment I need to take care of myself at home? And do I know how to use it? This may be equipment to help you with your daily activities, like a shower chair, walker, or cane, or other medical equipment, like a pump to run tube feedings. This equipment is key to becoming independent again. Second, do I know what medications I need at discharge and understand how they've changed since I was admitted? Review your old medication list and the medications you'll have at discharge. Do the lists match? If not, why not? Common mistakes made include sending a patient home on a new medication that does the same thing as one of your old medications. This can happen because hospitals buy different drugs than your insurance company. Make sure your team converts your medications to ones that your insurance will buy. This will avoid you taking 2 drugs for the same thing or buying medications you already have at home. Sending a patient home on a new medication that was needed in the hospital but won't be needed at home. One example is a medication to prevent stress ulcers. If you weren't on this at home before the hospital, you probably won't need it when you leave. Changing the dose of a medication because of your illness. For example, the dose of blood pressure medication may be reduced in the hospital when you're sick and eating differently, but the dose may need to change again after you go home. Not having enough pain medication. If you've been taking pain medication during your stay in the hospital, do you have enough pain medication to get you to your first follow-up appointment? Do you have printouts for these medications? Most pain medications require a paper prescription and cannot be sent to the pharmacy electronically. Third, do I have all the follow-up appointments that I need? Physical impairments are common after critical illness. Make sure you have appointments with your primary care doctor, any specialists, and ask if you need appointments with physical therapy, occupational therapy, or speech therapy. If your team gives you phone numbers to make your own appointments, make sure you know who to call if you have trouble making the appointments in the time period your team wanted. For example, within 2 weeks of discharge. Also, ask the team who you should call prior to your first follow-up visit with questions. Fourth, do I need any follow-up tests? Are there any outstanding test results from the hospital? For example, biopsy results or blood tests. Fifth, and finally, what do I do if I'm struggling at home? When patients leave the hospital after an ICU stay, it isn't uncommon to struggle with your mind, body, and spirit. Who can you call to help you? Are there support groups in your area? Can you or do you need a mental health referral prior to leaving the hospital? This is a long list of questions, but they're all critical to you leaving the hospital and staying out of the hospital. Make sure you get answers to each of these questions and be insistent that the paperwork reflects all the answers the team gives you, because all your caregivers moving forward need the same answers to these questions. You can do it. You just have.